Well, it started as just a small blister on the side of my foot, and because I'm a diabetic, you have reduced feeling in your feet, and anybody else might have felt it a little sooner and it might have worked out better for them, but because of complications with reduced circulation in the foot and reduced feeling in the foot, it became infected, and it became quite a big deal at that point.
When I first met Bill, he had a very severe leg-threatening infection in his foot. The real fear here was that Bill was going to end up with a major limb amputation, losing the leg either above or below the knee. My name is Dr. John Byrne. I'm a vascular surgeon. I'm also the medical director of the Wound Healing Centre in Glens Falls Hospital. The Wound Healing Centre is dedicated to treating patients who have problem wounds, chronic wounds, that's wounds that haven't healed after several weeks of routine treatment. The type of patients we see here are patients with diabetes or vascular disease, arterial disease. We also see patients with problem wounds in which the cause of them is not really clear. We often see patients here who have been undergoing very standard wound care for several weeks or several months without actually anybody addressing what the possible cause of that wound was. And that's what we have the ability to do here very well.
The wound center was just a great experience for me because it's an outpatient type thing. You're not, after being in the hospital and you can't leave for a long period of time, then the wound center is just great, and the people there are great. I credit them with being where I am now. I don't think you can go through this process alone. You have to have a lot of professional people tell you exactly what's going to happen if you don't do this right, and exactly what you need to do to get this healed up.
We have a systematic approach to diagnosis. We start by assessing the blood flow, or what we call vascularity of the wound, and then we proceed in a stepwise approach. We look for source of infection in the bone. We look, if the patient's diabetic, we look to see how well their diabetes is controlled. We look at nutritional status of the patient to see if they're malnourished or if they have factors that need correction in the diet. It used to be thought by vascular surgeons that all you really need to do is to restore the circulation to a wound and it would automatically heal. We know that's only part of the solution now, and there's an increasing awareness that wound healing centres and a multidisciplinary approach like we have here in the Wound Healing Centre is essential to achieving good outcomes and good healing rates. And by that I mean using things like what we call offloading devices, hyperbaric oxygen therapy, wound vac therapy, and what we call bioengineered skin substitutes as well. We also have a big team of physicians here from multiple specialties, ranging from plastic surgery to infectious disease to podiatry. We have physicians here specialised in family medicine, and all physicians here in the centre have completed a specialist training course in wound healing.
And I credit them just totally. I couldn't have done this on my own, and they keep you optimistic. They tell you what you need to do for the next week, and they emphasize the things that you really need to watch. And if you see this or that, then to call them right away or come in to the emergency room and don't let this go, and exactly how to handle it.
Yeah, as a physician, it's very gratifying to see patients who have very chronic, very difficult wounds, and they leave here healed. And that's especially if they've been living with this wound for a long period of time before they come here, and then we can do something which really affects their quality of life.
I'm optimistic about things, and I have good reason to be now. Once you see a light at the end of the tunnel, then you can follow it, and I think it makes it a lot easier.
Yeah, I would expect that Bill will return to normal activities, to fairly normal functioning. Certainly his quality of life is going to be infinitely better than if he had undergone a major limb amputation. So I think this is a great result, and he's been a great success story for the Wound Healing Centre.